This is breaking news.
Governor Murphy is giving an update on the coronavirus pandemic in New Jersey. Let's listen in.
The Commissioner of Labor and Workforce Development, Rob Acero-Angelo, is back with us. Great to have you, Rob. And to my far right, a very good friend, Cape May County Freeholder Vice Director and the Mayor of Sea Isle City, one of New Jersey's great communities, Len Desiderio. Len, great to have you, man. I've asked Rob to give us an update on the work of his department to ensure every New Jerseyan who has filed for unemployment gets a swift determination of their claim. And the freeholder is here because today we have some good news for our shore and lake communities. I also want to give a shout out to the Director of the Office of Homeland Security and Preparedness. Jared Maples is here, Head of Intergovernmental Affairs. Mike Delamater is with us, who will be answering questions, I suspect, for the next 10 days, or at least 8, on what this means for beaches. Mike, thank you for your help. And Chief Counsel Matt Plaka will join us shortly. Len, it's hard to believe you and I were together for a 5K on February 16th in Sea Isle City. It feels like 5,000 years ago at this point. It's unbelievable. Throughout this emergency, the freeholder, not just with me, but with Mike and our teams, have had numerous exchanges about the big step we're taking today on our road back, and that is ensuring that the Jersey Shore can be open to families across our state and region, and we can do it in a way that is consistent with protecting the public health of every beachgoer. The Jersey Shore, after all, is where memories are made. The last thing any of us wanted was for a summertime down the shore to be a memory. Today, I am proud to announce that yes, our shore and our lakesides, and our lake shores rather, will be open. And as with all of our decisions, we followed our core principles that data determines dates and public health creates economic health. Just as importantly, the steps we are taking today are also coordinated with our neighbors in Delaware, New York, and Connecticut. This is an approach that is absolutely essential to our futures, both as individual states and as a region. And here in New Jersey, we have also engaged in direct discussions with leaders up and down the shore at all levels of government. Folks and friends like Len, who knows the issues of our shore communities and economies better than anyone else. I mentioned the other day that we had a great conversation with both the 4 shore counties and a number of the municipalities and mayors just a couple of days ago, earlier this week. I also want to give a shout out to some other folks. Senator Vin Gopal, who represents so many of our great Monmouth County beach towns. His advice and counsel and advocacy for our shore towns was similarly invaluable. I also give a shout out to another friend, Monmouth County Freeholder Director Tom Arnone. I also, just by example, and again, Monmouth's my county, so I'll brag, Mark Walsifer and his team in Belmar put forward, in particular, a really smart beach plan. And I want to thank all of the other local and county officials from up and down our coastal communities. This was truly a collaborative process, again, not just Monmouth and Ocean and Atlantic, but obviously Cape May, represented by Len today. We want everyone to have fun, but we need everyone to be safe. To accomplish both, we will be requiring restrictions on how many beachgoers may be allowed on any beach or lakefront. And the social distancing we've been practicing in our hometowns will be extended to our beaches. And to be clear, no one will be discriminated against. No community can turn a public beach into a de facto private one. All visitors must have the ability to enjoy our state's greatest natural resource. Every beach will be required to establish capacity limitations, but we will leave it to local leaders to determine the method that would be best for their community. This can be done through methods including limiting the numbers of available beach tags for any given day, or through utilizing technology such as with a geographic spatial analysis. Social distancing measures requiring at least 6-foot distances between beachgoers will be enforced except for family groups, household members, caretakers, or couples. This is the same approach we have taken with parks. And again, we will leave it to local officials to determine how best to implement these measures. Each of our shore and lake communities have unique characteristics, and we know there is no one-size-fits-all approach. However, some restrictions do fit across the board. Organized games and contact sports will be prohibited, as will beach recreational summer camps and special events that draw people to the beach, such as concerts, festivals, or fireworks. Sanitation will also be of great importance, especially since this order will allow for shower pavilions, changing areas, and restrooms to remain open for visitors, and they must be regularly and properly cleaned. And with this order, I am also directing the reopening of restroom facilities at our parks, so long as they undergo frequent and proper cleaning as well. Commissioner of Department of Environmental Protection, Catherine McCabe, Matt Platkin would want me to remind everybody that it will take a while for us to roll through with the proper seasonal staffing to get all those restrooms up and running and open and properly sanitized. So at the parks, please bear with us. That will begin, I think, as early as Saturday, but it's going to take some time. On our boardwalks, restaurants may continue to operate for takeout and delivery only, but the rides, arcades, games, and other draws must remain closed. Other features that are meant to draw a crowd, a waterfront fountain, a playground, or visitor interpretive center must similarly remain closed for the time being. This is not a life sentence here. We could have a dramatically different reality a month from today. And I promise you, we're going to monitor this for both sides, by the way. We've got to comply, folks. You've been extraordinary. We've got to continue to comply now at the beach. And assuming we do, and assuming the curves keep getting better, and assuming Judy and her team feel comfortable, we will be able to take more steps. And I promise you, we will not hold those steps back 1 minute too long, nor will we jump the gun, I hope, not 1 minute too soon. Our beach and lakefront communities and counties will also engage in comprehensive public outreach campaigns using both traditional and online media, and yes, even the ubiquitous planes carrying banners to ensure that all visitors are aware of the restrictions in place as well as what is expected of them while visiting. And while we are not specifically ordering it, we highly recommend that you wear a face covering, particularly when social distancing is difficult to maintain, such as waiting in line for a slice of boardwalk pizza. As I've said many times throughout this emergency, that I wanted to find a way to allow our beaches to be open for the summer. I applaud Len for raising his hand in partnership for bringing together a broad coalition of Cape May shore towns and for working with us so we could reach this day. I can't say enough good things about the level of cooperation, Len, to you and your colleagues in Cape May and frankly right up the coast in Atlantic Ocean and Monmouth. But you're here today for a reason. It starts with you, and thank you. We are living through unprecedented times, but we have confidence that residents and out-of-state visitors alike can take in a day at the beach safely, so long as the measures we are announcing today, and which are outlined in further detail in the order itself, are followed. And by the way, I should say this, it does not say in my remarks, this is all, Mike, effective Friday, May 22nd. So folks, we're giving the shore communities and counties an 8-day runway to get to take these general guidance points and make them work for their communities. Again, public health determines economic health. Our shore economy is a tremendous driver of local jobs and revenues. Because of the work of millions of New Jerseyans, of you all out there to slow the spread and flatten and lower the curves, we can confidently take this step today. And by the way, data determines dates. Memorial Day weekend is still more than a week away, but the data tells us we can make this announcement now. After months at home, I know many families, probably measured in the hundreds of thousands, if not millions, cannot wait for a day either down the shore or alongside one of our lakes. And I am proud now to be able to give them that day, a day they worked so hard to make possible. Again, I want to thank the freeholder for traveling all the way from Cape May to be with us, and I thank him for his advocacy for our shore communities and his insight, which has been invaluable in crafting a plan that will ensure that families will continue to create their shore memories. We'll hear from Len in a few minutes. So this Memorial Day, New Jerseyans can still have the words that ring in our ears thanks to Messrs. Springsteen and Waits. because down the shore, everything's all right. And even in these challenging times, that is exactly as it should be. By the way, we are aggressively reviewing pool protocols as well as charter fishing, which are not part of this executive order, but we would expect to have some guidance in the next number of days on each of those fronts. And with that, let's turn to the overnight numbers. Yesterday, we received an additional 1,216 positive test results for a current statewide total of 142,704. The daily positivity or spot positivity rates from May 10th, which is when the specimens were last collected, Judy, was 22%. Here's how this is reflected across regions of the state. As you can see, they're converged. The map that we've regularly been turning to keeps showing slower rates of spread across the state. And by the way, Len, not just because you're here, but a big uptick, which is a good thing in Cape May County on this map. In our hospitals, the number of patients currently being treated for COVID-19 has now dropped below 4,000 and stands at 3,958. This is a great milestone to reach, but let's remember this means we still have more than 3,900 of our fellow residents in our hospitals. Our field medical stations again reported 35 patients. This is a breakdown of hospitalizations across region. And here are total hospitalizations for every 100,000 residents, again across regions, to give a more balanced picture. Looking at our long-term care facilities, here are the numbers of positive cases, over 27,000, and fatalities connected to these facilities, 5,168, blessed soul. We continue to throw everything we've got to work to mitigate these numbers. And in our long-term care facilities, by the way, we can today announce that the federal, this is not the National Guard, this is the federal U.S. Veterans Administration is providing 5 10-person healthcare strike teams who will join the staffs at some of our facilities until June 30th. This is a big deal for us. I want to thank Secretary Wilkie and the whole VA team. They're expected to be in state by literally, I think, tomorrow or Saturday. The number of patients reported in either critical or intensive care fell again to 1,157. Ventilator use continues to decline, 898. There were 171 new COVID-19 hospitalizations yesterday, and the number of live discharges was 366. And here are the numbers from yesterday, by the way, broken down by region. Always nice to have bigger numbers on the right than the left, and that was the case, even though just by a hair in all regions, just by a hair in the South. Again, I cannot stress this enough. These trends are your doing. You are the ones who have pushed these numbers and these lines downward through social distancing, and as we begin our long road back, we will need to keep it up, to keep seeing these lines move downward, and that will give us even more confidence in the steps to come. Let's look at these numbers in a different light. This is a subset of a chart we've shown you for the past couple of days. Since the peak, all of the metrics we've needed to see in terms of hospitalizations have happened. New hospitalizations are down nearly 2/3 from peak and down by more than 1/3 in just the past couple of weeks. This is a strong number that relates directly to the slowing spread of COVID-19. Overall, hospitalizations are down by roughly half since the peak and more than 1/3 over the past couple of weeks. Patients in our ICUs and on ventilators have both dropped significantly since the peak and over the past couple of weeks. Here's how the overall numbers we report daily compare day to day in every category. There are a lot of green lights. So let's sit on this stand for a second. So the left side of this chart shows you what I just showed you, but the right chart are balls for each day. A red ball is a spike up, a green ball is a reduction, and you can see how the overall numbers we report compare day to day. Here we can see each of these metrics. Let's flip this if you can, by region within that all-important 14-day window we've talked about. Again, a lot of green lights. There have been one-day increases here and there, but as I've said before, as Judy has said many times, we can't get distracted by a one-day number. We have to look at the longer-term trend. It's just like the difference between the weather on a given day and, say, climate change. In the overall climate, is now hospitable for us and sufficiently hospitable for us to be taking the steps we've been announcing these past couple of days to begin to restart our economy in summer at the shore. Let's hold on this again for a second. Judy, you've said this from the get-go. You've got new hospitalizations, patients in total in the hospital, ICU patients, patients on ventilators. You see a pretty equal split regionally on new hospitalizations. There's no other way to put that. So in terms of the upward spike days, and that's something we've got to watch. Otherwise, it's largely in the south, and that's exactly as you had predicted, that this was going to go from north central to south. And so you see more red balls on that bottom south line in both patients in the hospital, patients in ICU, patients on ventilators. There's almost an absence, with one day's exception, of spikes in either the northern or central region. We're watching very closely not just the migration, which we had predicted, but that upper left chart where you've got new hospitalizations, to make sure that all the great work, I'll pick a county like Bergen or Essex or Hudson, which had been particularly slammed, and they had driven this so far toward the ground that we're not seeing any flare-ups on the backside. Again, social distancing has worked. It is still working and will continue to work in the weeks to come as we take further steps. But, of course, let's not get too ahead of ourselves. We are not out of the woods yet, and this next slide is one we've been showing the past couple of days, shows the current impact of COVID-19 across our region and in comparison with other states in America. Again, we can make the case that at this moment in time, we are the most impacted state in the nation. And this is why we need to keep up the social distancing even as we begin to restart and recovery. Again, this is shifted. We're doing this. This is as of, I believe, 2 days ago, yesterday. Dan, is this the 13th? As of yesterday. So you've seen we have slipped a little bit in new cases per 100,000. That's a good thing when you slip on this chart. So Connecticut is now just out ahead of us. Patients in the hospital per 100,000, we're still number one in the country. And sadly, new deaths per 100,000, we are still number one in the country. So not only is this chart remind us why we have to keep up our social distancing, but the past couple of charts, I hope, gives you some sense of the needle that we have to thread here. Enormous progress on the one hand, and that's unmistakable, with some flare-ups that we got to make sure that we're keeping a very close eye on. And on the other hand, we are as impacted a state still as we sit here today as any American state. And clearly the tragedy within the tragedy are the long-term care facilities. And the notion that this can spread intergenerationally. It can spread from healthy to non-healthy folks with comorbidity. So let's keep at it, everybody. Let's see good things at our construction sites and in our downtowns starting on Monday, and let's make Memorial Day weekend not only fun, but safe. You've been extraordinary. Let's keep it up as we take these incremental steps. So this good news aside, in terms of the steps we're taking, there remain countless families who have been dealt the worst news of all, that they have lost a loved one to COVID-19. And today we report that another 244 precious members of our New Jersey family have lost their lives from COVID-19 complications. Our statewide total stands now at a staggering 9,946. In all likelihood, I would like to think otherwise, we will pass another solemn milestone tomorrow. As we do every day, let's remember a few of the incredible lives we've lost. Let's start by remembering a guy I heard a lot about yesterday, Scott Geiger. He was one of our frontline public health heroes, a career EMT. Scott was only 47 when he passed, and he had been an EMT for 30 years, meaning he became an EMT when he was 17. And for the past 17 of those years, he spent them with Atlantic Mobile Health. His brother, Ben, with whom I had the great honor of speaking yesterday, said Scott simply lived to help people in their most desperate moments. And he made a point of saying Scott never called what he did a job. He always referred to his EMT activities as his duty. Scott's second love was the New York Jets, even if they did not always love him back. But he knew perseverance, and you have to be that way if you're a Jets fan. After all, Scott defeated cancer 7 years ago. He was a great friend to many, the first to step forward to help or to get a colleague a cup of coffee or breakfast when they were busy, but he loved his family the most of all. To Scott's mother, Joyce, and she's had her challenges, his father, Sandy, his brother, Ben, with whom I spoke, his loving aunts, uncles, cousins, nieces, and nephew, his goddaughter, Lauren, we send you all our deepest condolences, and you are in our thoughts and prayers today. And Scott, my buddy, we thank you for your service to the people of New Jersey and for always doing your duty. Next up, this is Judith Ann Ferrara Coppola. Judy was born in Newark and lived in Union. You won't be surprised when I say this, given that photo. In her youth, Judy was a model, but her real passion was her family. They recall that Judy was at her happiest when everyone was gathered around the table. But outside, she took equal pleasure in spending time on the beach at Spring Lake with her children, or going on a road trip with her sister, Terry. I had a long conversation with her sister, Terry, her big sister, Terry, by the way, who essentially had acted not just as her big sister, but as her second mom. Among other things, they were both hairdressers, and I've never met Terry face to face, but I can tell you based on my conversation, she would fit comfortably into the category of a pistol. She was something, and so was her sister, Judy. Judy enjoyed a game of bingo and also enjoyed watching, in this case, her New York Giants play football. I'll incorporate the prior comments by reference. She was 69 years old. Judy leaves behind her 2 sons, Michael Jr. and Vincent, along with their wives and 2 grandchildren. She also leaves her beloved sister, Terry, as I mentioned, her second mom, and her family, including her nieces and nephews. We keep them all in our prayers and thoughts today. God bless you, Judy. And finally, we remember Marie Spicchio. She was born and raised in Newark. She lived for many years in West Orange and moved to Toms River 23 years ago. Her family remembers her as, quote, the traditional Italian mother who loved her family and ruled with a wooden spoon. And does that picture say that in spades, huh? God bless her. She loved to bake and to ensure that her family always sat down to a good meal, especially at Christmas. Marie devoted herself to St. Gerard, the patron saint of mothers, and was a member of the St. Gerard Ladies Guild. She also was a breast cancer survivor, bless her, and now she is reunited with her beloved late husband, Michael. She leaves her daughters, Susan and Michelle, and I will tell you, having spoken with both of them yesterday, they remain, and who could blame them, devastated by their mom's loss. She also leaves behind Michelle's husband, Frederick, and their 2 kids, Marie's grandchildren, Brittany and Nicholas. She also leaves a sister, Anne, many nieces and nephews, and she also leaves behind her furry friends, especially her best friend, Zoe Rose. May God bless you, Marie. May God bless your family at this extraordinarily difficult time. 3 more members of our New Jersey family who COVID-19 has taken. Let's never forget them. And by the way, unrelated to COVID-19, and I have to say that explicitly, but we lost a giant overnight. Jerry O'Connor, former Saddlebrook mayor, freeholder, director in Bergen County, state senator, a giant. We lost Jerry overnight. I spoke with his wife, Terry, who herself is a giant, and their son, Kevin, who is a very dear friend of mine. So I want to give a shout out to the O'Connor family and to say that Jerry and his memory are in our prayers. Switching gears, I'm going to leave the report from the Department of Labor and Workforce Development to the Commissioner, but I do want to give Rob and his entire team a huge shout out. As Rob will report, the department is clearing 140,000 residents' claims off the backlog this week. And I know they're going to keep at it until they deliver for every eligible resident. If you're frustrated out there, Rob doesn't blame you, I don't blame you. But know that an enormous amount of progress has been and continues to be made, and that you will get every single penny that's coming to you, including the federal piece. So Rob, thank you to you and your team. I also want to note, and I want to give Pat a shout out here, that the Office of Emergency Management has passed another milestone in their efforts to ensure that our frontline healthcare workers and first responders have the personal protective equipment, or PPE, that they need to do their jobs. The Office of Emergency Management, affectionately called OEM, has now passed out more than 42.6 million pieces of PPE that has been distributed. 2.5 months ago, that was not a line of business in either the OEM or the state of New Jersey. We're now well over 42 million pieces out. So Pat, to you and the team back at the Rock and in the warehouse, congratulations and job well done. Now, with the news that there will be summer at the Jersey Shore and at our lakes, let's close on an equally inspirational and upbeat note. Let's start in North Arlington with George Zachary. That's a t-shirt George has got on, huh? George lost his father, Adele, on 9/11, and his sister is a healthcare worker. He's been running the Breakfast for Our Heroes campaign to provide breakfast for healthcare workers across the state. He's already hit 24 hospitals and is now focused on serving those at Clara Mass Medical Center in Belleville and St. Barnabas Medical Center in Livingston. And just as importantly, he's been leaning on local coffee shops to provide the goods. So he's supporting our small businesses in the process. So to you, George, keep it up. One breakfast sandwich and cup of coffee at a time. I know our frontline heroes thank you, and we do too. And lastly, this is a big one. How is this for an inspiration? Let's bring up Allendale's Sylvia Goldschall. Sylvia is 108 years old. She was 7 years old during the 1918 flu pandemic, and she survived it. Last month, Sylvia tested positive for COVID-19, and now we can say she has beaten that. A tremendous life, a tremendous spirit, a tremendous show of strength, a tremendous role model for all of the rest of us. So to you, Sylvia, we send you all of our best for the many, many more years to come. How about perhaps another 108? And I think that's as good a place as any for us to end my remarks today. With that, I'd like to introduce again a friend, the Vice Director of the Cape May County Board of Chosen Freeholders, the Mayor of the precious Sea Isle City. Please help me welcome Len Desiderio. Len, thank you for being here.
Governor, thank you. And it is my honor to be here. And happy birthday to Sylvia, 108 years old. And I too wish her another 108 plus years. Governor, I have to start off and just thank you for your strong leadership during this entire time. Your staff and you have been absolutely fabulous. And as I've said many, many times, this is not a Republican or a Democratic problem. This is a problem that we all need to work together with. We all need to come together, and under your leadership, Governor, we are moving forward, and I do see light at the end of the tunnel. It is fabulous news about the beaches. I can't tell you how happy we are in Cape May County, and I'm sure across the 127 miles of beaches in New Jersey, to be able to open up our beaches. I know that in Cape May, and in particular in Sea Isle, they are now waving to me with 5 fingers. So I'm very, I'm happy for that, and it's great. What we are planning to do, and this is with Ocean City, Strathmere, and Sea Isle, is to have a dry run this Saturday for capacity management, in which we can learn and go to school. This is something we've never had to do before. Our job has always been to bring as many people as we can to the beach, as many people as we can to our communities. Now we are practicing capacity management. We're going to have a Memorial Day. It's going to be a little different. We're excited about the beaches being open, but the 3 communities, and I know other communities in Cape May will be joining us, but the 3 communities are going to be practicing this Saturday. We're going to be observing it, and we're going to learn how to go to school. As you know, the Cape May County Board of Chosen Freeholders put together a task force, and it was headed by freeholder Will Morey and myself, along with business leaders from throughout Cape May County from all walks of life. And we worked many, many hours to come up with a plan which promoted safety first, but was allowing us to get our businesses, we feel, open. We presented it to you and your staff, and once again, Governor, I have to tell you, going back and forth with your staff has been a fabulous, fabulous thing for us, because when we report it to our community, when we report it back to our council, when we report it to fellow freeholders and our citizens, they really do appreciate that the line of communication between us and the governor is the way we're having it, and it's the way it should be, and I do appreciate that. And as you know, we've presented this plan to you and your staff. We've had a number of conversations with your staff, your chief of staff, Michael. Alex has been wonderful dealing with the mayors and et cetera. You getting on the phone on Tuesday was wonderful with 24 Shoretown mayors. And as I said before, this is not a Democrat or Republican problem. We have all worked together. And by opening up small businesses for curbside shopping, which will start on Monday at 6 o'clock, it has relieved such a burden from these mom and pop shops, these small businesses. When this first started, we have to remember, they were bringing in their stock for the spring. It was March. They were bringing in their spring attire. They were getting ready to open, especially at the shore communities. Some of them never even got to be open when we had to close down, and they have been closed down for 59, 60 days. This is a shot in an arm to them. This is something we thank you for. This is something we're going to follow. And what I've said to the freeholders, to Cape May County, and to my community of Sea Isle City is that we all need to work together. We walk together, we move together. This is something new. When we have a storm coming, and as bad as a storm is, we generally know how to prepare. We know what to do. We know when we have to evacuate. With this, you know, and after the storm, we know that there's repairs. We know there's beach replenishment. We know that shop owners, homeowners have to make repairs to their property. With this, we didn't know what was coming, how it was coming. The governor's daily briefings that he has done, along with these wonderful people up here, has been an inspiration, and it has given the elected official and the citizens of Cape May County something to hope for. And that's what we have, hope. We have great hope. We've been following the governor's orders to the T. We will continue to follow the governor's orders, and we're moving forward. And great news for the shore with the beaches open. Great news for the shore with the small businesses able to do curbside business, and we will continue to move forward, and we will watch capacity management, and we will move forward together. And I have great hope for us, and I have great hope for us this summer. And thank you, Governor, once again for your leadership. We will be working together. I have your cell phone number, so watch out. I'll be calling you many, many times. And thank you for compiling such a great staff that takes care of not only the freeholders, the mayors, but all of the citizens of Cape May County. God bless you all, and thank you.
Len, that was incredibly powerful, and cannot thank you enough for your leadership and your partnership. You're such a good guy. In fact, you even just promoted Della Mater. But seriously, you've been incredible to work with. We knew that before this, by the way. You and I have known each other before this crisis, but we've really got to know each other during this. And so to you and your team and your fellow freeholders and the mayors in the communities, cannot thank you enough. And again, you put together a really good model in many respects. What we've announced today through this executive order is an homage to the model that you put together in Cape May County. So thank you, Len, for this and for all. And I know our team thanks you. Now, I don't know why I feel this way today, but I introduce the woman to my right every day, both at the beginning for her remarks and at the end. And almost inevitably, it's Tina Tan is with her, or Ed Lifshitz, and I want to give Christina Tan a shout out as well. But Dave, you asked me, I thought about this yesterday, you asked me how was this going for me? And I chose to run for office, and I chose this position as an elective matter. And when you do that, you go with that goes not just the thick skin that I referred to yesterday, but you go into that with your eyes open. And so I'm going to be just fine, win, lose, or draw. I know that for sure. But you have no idea, folks, what it is like walking in the shoes of Judy Persichilli. Now, do we always bat 1,000? God knows we're going through this for the first time. Who could bat 1,000? But no one has done more over the past 3 months in this state, and I would argue in this country, as a health matter, as a leadership matter. She has been absolutely extraordinary, with literally the weight of the lives of 9 million people on her shoulders, morning, noon, and night. We could not ask for better leadership, and I'm incredibly humbled to sit here every day alongside of her and to go to battle with her every single day, morning, noon, and night. Please help me welcome the Commissioner of the Department
You've been
of Health,
listening to Governor Murphy give an update on the coronavirus outbreak in New Jersey. We're now returning to regular programming on CBS 2. For extended local coverage, stick with our streaming service, CBSN New York.
This has been a special report from CBS 2 News. We now return to our regular programming.
Infection control recommendations and help residents with activities of daily living. These individuals are in addition to the over 100 VA personnel supporting our vulnerable residents at the Menlo Park Memorial Veterans Home and the Paramus Veterans Memorial Home. The state now has over 300 National Guard members throughout the entire state, from Sussex to Cape May, working in long-term care facilities and in our hospitals. We are grateful to the VA and the National Guard services. Any additional support, be it direct care or direct caring and comforting, is appreciated. As I covered yesterday, we are getting increasing reports of pediatric multi-system inflammatory syndrome from our healthcare providers. The department is investigating 17 possible reports of this condition. Yesterday, I shared that there were 18 possible. One report did not fit the definition. These are among children ages 2 to 18. They're in 9 counties: Bergen, Essex, Gloucester, Hudson, Middlesex, Monmouth, Passaic, Union, and Warren. This is a rare condition, but it can be treated. Early recognition is important, so we ask that parents look out for the symptoms. Your child may seem irritable or sluggish. Your child may have abdominal pain without another explanation, or episodes of diarrhea or vomiting. Your child may have a rash, conjunctivitis, enlarged lymph nodes, or red, cracked lips, or a red tongue, and perhaps swollen hands and feet. Please call your healthcare provider if your child has any of these symptoms, so that your baby can be evaluated and treated. We are concerned about the incidence. We will look at every single report, but at this time, we have not established a clear link to COVID-19. The Department of Health put out a public health update on May 7th to all clinicians to alert them to be aware of pediatric multi-system inflammatory syndrome potentially associated with COVID-19. The alert noted that we are working closely with the CDC and our neighboring states to investigate reported cases of multi-system inflammatory syndrome that may possibly be associated with COVID-19. Cases characterized by persistent fever and features of Kawasaki disease and/or toxic shock syndrome were reported in the United Kingdom and have recently been identified in children in the United States. The governor reviewed the new cases and deaths. In terms of deaths, the breakdown of deaths by race and ethnicity is as follows: white, 53.5, black, 18.6, Hispanic, 19.1, Asian, 5.4, and other, 3.4. There are 525 long-term care facilities in the state reporting COVID-19 cases for over 27,000 cases. At the state's veteran homes, similar to yesterday, with a census of 662, 366 residents have tested positive, with a total of 137 deaths of our residents. At our psychiatric hospitals, with a census of 1,240, we are reporting an additional death at Ancora for a total of 13 patient deaths at the psychiatric hospitals. The daily percent positivity for the day, May 10th, was in New Jersey overall 22%, North is 20%, Central 23%, and South 25%. That concludes the daily statistical report. As we take incremental steps toward reopening, I want to remind everyone to continue to take steps to protect your health. Stay home when you're sick, clean and disinfect frequently touched surfaces, cover your mouth and nose with a cloth face cover when around others, cover your coughs and sneezes, and wash your hands frequently for at least 20 seconds. It is important that we stay vigilant to continue to reduce the spread of this virus in our state. Stay connected, stay safe, and stay healthy. Thank you.
Judy, thank you, and thank you for that. We haven't said it in a couple of days, but the racial inequities are something that you and I and our teams, and Lieutenant Governor Sheila Oliver, who we want to give a big shout out, who's in Atlantic City, by the way, today, is something we continue to look very carefully at. And I meant every word and then some. So thank you very much to you and Tina. And again, on this Kawasaki piece, you made the point, Tina, on the call earlier, this is treatable. So you identify the symptoms early and get to your healthcare practitioner, and this is something people can recover from and get through, so with the proper treatment. Thank you. Again, another guy who's not sleeping much, to him and his team, who are doing an extraordinary job in the face of a tsunami unlike any we've ever seen before. And again, that's not meant in any way to make you feel better if you're not getting through yet. We understand that, but it's Thursday. This is the day that both the U.S. and each of the states announced the new unemployment claims, and we thought it was a good time to ask the Commissioner to join us. Please help me welcome the Commissioner of the Department of Labor and Workforce Development, Rob Acero-Angelo. Rob?
Thank you, Governor. As I said last week, it is a harsh reality that COVID-19. Thank you, Governor. As I said last week, it is a harsh reality that COVID-19 swelled the nation's unemployment rolls to unprecedented numbers in a few short weeks, as shown by more data released today. As business as we knew it ground to an abrupt halt here and everywhere else. But every single day, thousands and often tens of thousands of new claimants begin receiving benefits due to the hard work and dedication of the Department of Labor and Workforce Development staff. I want to lead with a sincere thank you to our claimants for their patience and understanding as we work toward getting 100% of our eligible workers the benefits they are due. With such big numbers, it may not seem like it at first glance, but New Jersey's unemployment insurance system is working as intended, with nearly 800,000 unemployed and underemployed workers receiving state and federal benefits. That's more people than live in 5 U.S. states. More than $2.7 billion has been deposited into the bank accounts and onto the debit cards of eligible New Jersey workers. According to a Tuesday New York Times article, in 2019, New Jersey led the nation in percentage of eligible unemployed workers receiving benefits. The same was true in 2007, and many of those same folks who set this standard are working right now, as I speak, to process even more claims for our state. The mission of this department has never wavered, to lead the nation in delivering on our promise to ensure our workers receive every benefit they are entitled to, unemployment and others. Right now, according to that same Times article, our state is still performing better than most to pay out benefits after this crush of layoffs and temporary furloughs due to COVID-19. But as I've said, this means little to those still waiting for their benefits, and we want to do more. Since unemployment insurance is a federal program, the U.S. Department of Labor, my former employer during the Obama administration, has just reaffirmed strict guidance to states, noting that many of the outside-the-box solutions we have been exploring, such as temporarily suspending or amending the troublesome weekly certification process, cannot be enacted without putting our entire unemployment system, including billions in CARES Act funding, at risk. This isn't some dusty law we pulled off his bookshelf. This memo you see up there came earlier this week. But here's what we can and have done this week alone. Today, through upgrades and improvements in processing, I'm proud to announce that an additional 139,000 claimants are being made newly eligible, which is hopefully of some comfort to many of those who have been waiting for benefits. To be clear, this is in addition to the tens of thousands who regularly become eligible each week in normal course. It includes nearly 60,000 claims in the third batch of the pandemic unemployment assistance claimants that were just converted for processing, meaning essentially everyone who is eligible for this new federal assistance and applied by April 12th, which is an overwhelming majority of them, has been processed. This is incredible work, which I will detail more later, but we want to thank all of our staff who have been embarking on creative solutions to the historical volume of claims that came with this pandemic. We also appreciate all of the ideas coming from the public and our lawmakers to increase our staffing capacity. We've been working on this, as I mentioned last week. It's important to note that an unemployment claims agent cannot simply be plucked off the street and sat in front of a computer screen. Handling sensitive personal information such as Social Security numbers, birth dates, and bank account information requires trust and a state police background check. Thanks, Pat. It means knowing the ins and outs of unemployment law. It means making benefits decisions based on nuanced state and federal regulations, and it takes experience with our systems, especially at this time. However, in addition to hiring and beefing up our call centers, the Labor Department is making the most of the talent at our fingertips, and I couldn't be more proud of our employees for stepping up to the challenge of COVID-19. For those of you who are unfamiliar with unemployment, I'd like to take a moment to explain how the process works. Wage earners and their employers pay premiums into the Unemployment Trust Fund. And when they are separated from an employer through no fault of their own and otherwise eligible, they receive the insurance payments they deserve. But now there are hundreds of thousands of workers who have never been part of that system at our door for their PUA benefits. We will be reimbursed from the federal government for the benefits paid out, but the amount of time and effort that has gone into serving this new group of workers has impacted all of our customers. This additional universe of workers includes independent contractors, self-employed workers, and workers who don't have enough income history to qualify for regular unemployment. While we're thrilled these workers who have been negatively affected by COVID-19 are getting government support through pandemic unemployment assistance, it's presented an entirely new set of challenges as systems that have been in place for a certain type of worker are now serving as a catch-all. These 200 to 300,000 people need to have their claims reviewed because there's incomplete income information for these applicants, and their wages must be verified by labor staff per federal law. There is no way around this. Imagine if every VA hospital was told that tomorrow, in addition to veterans, they must immediately start accepting any patient who's ever in the Boy Scouts, Girl Scouts, or wore any kind of uniform. Eventually, they'd be able to assist this population. But in the short term, it's obvious to see the challenges and delays it would pose to its typical traditional patients. But we are absolutely making progress. As I mentioned earlier in my remarks, this week another 139,000 will become eligible for benefits. And besides the PUA, it includes 82,000 claims that may have been pending for weeks due to non-monetary appointments, Social Security number errors, and other identity-related issues, and those that were stuck due to lingering certification response errors. We'll make these claims payable now, so claimants can receive benefits while waiting for adjudication. This is a big step, and it's one more piece to our puzzle that is falling into place. While there are small percentages of people who have been waiting for some time, it's not because of a system glitch or delay by the agency. It's because for some reason, under unemployment law and US DOL guidance, they are not immediately eligible for benefits. If not for system upgrades made during the Murphy administration and programming improvements since pandemic hit, the number of claimants receiving benefits would barely be over half of what it is today. But now that there is such an incredible number of people in the system certifying benefits, we ask all of our claimants to follow our Social Security number-based schedules so we can regulate the load coming into our systems. And take a moment, or two, or three, to read the important guides we've posted to make sure they are answering questions correctly. We know many, many thousands are still getting tripped up on the required questions, as shown before in that earlier USDOL memo. This past week alone, over 40,000 claimants locked themselves out of the system for their weekly benefit. and that is adding to the volume our agents need to handle. These inquiries are preventing those who truly need to speak to an agent from getting through. That is why we put out the step-by-step guides and why we launched Dolly, the Google chatbot, last week, which has already seen 110,000 engagements. We want to help everyone, especially as we're preparing to make approximately 139,000 additional self-employed workers, independent contractors, and others awaiting benefits newly eligible this week. These folks will be receiving email instructions on how to claim their weekly benefits starting this Sunday. I am proud of this progress, and while we wish we could wave a wand, hire unlimited staff who have already had years of UI experience, and have everyone paid today, the process is not that simple. We must protect claimants' personal information, prevent fraud, and more importantly, obey U.S. Department of Labor rules, all while paying benefits in the timeliest manner possible. Until then, I'd like to remind all of you to visit our website at myunemployment.nj.gov, and please know we are singularly committed to our claimants and getting them every penny they are eligible for as quickly as we can. Thank you, Governor.
Rob, thank you, and thank your extraordinary team. And I know this is unlike anything any of us have ever dealt with before. So to folks out there, please keep the faith. Again, to repeat something we've said every day, you will get every single penny that you rightfully deserve, including the federal monies. And Rob, again, I can't thank you enough for your leadership and your team's extraordinary efforts. Thank you. With that, we have a guy we hear from each day, Colonel Pat Callahan, with any updates on compliance, PPE, infrastructure, protocols. Anything you got, Pat? God bless you.
Thanks, Governor. Good afternoon. Probably one of the more, if I can use the Q word in law enforcement, one of the more quiet nights for compliance. Newark Police Department issued 275 warnings, which I think is a good thing. And one other incident in Elizabeth where a subject was cited for hosting a large gathering. And Governor, since you mentioned the benchmark that we've hit with regard to PPE, it's a good time to also thank, and he happens to be here today, Commissioner Asaro Angelos has in the Department of Labor public safety staff who are responsible for inspecting all of that PPE before it goes out, so we make sure that we're not sending bogus or not good equipment out to our first responders and healthcare workers. So just a huge thank you to you, Rob, and to your staff there. And just lastly, just to somewhat tag team on your remarks about the Commissioner of Health, I just did the math. I have been with her or on the phone with her for the past 83 days straight. I think it's within my authority to designate her as an honorary trooper. The synonym for trooper is fighter, warrior, soldier. She fits the bill on all of those things and then some, and I'm honored and humbled to serve with her every day. So thank you, Trooper Judy, for doing what you do. Governor?
That's far more impactful than anything I could say, that's for sure. Pat, thank you again to the OEM team, to your inspection team, Rob, and certainly to Judy and Tina and the Department of Health. And again, Len's here today because we've said all along it takes a village. I had a good meeting with the Senate President and the Speaker last night. We spoke about a number of things, including we all felt a good meeting was had yesterday at the working group level on bonding and our ability to take advantage of the bonding opportunities. But we don't get here, any of us, by ourselves. And your point in terms of just the day in and day out nature of something like this is extremely well taken. You know, one of the things that came up on the call that Len and I and Mike Delamater organized the other day, and Pat, I know you'll be all over this with your colleagues, as well as local and county officials. We'll have inevitably a lot of people who want to let some steam off. Who could blame them, having been staying inside for so long? And so, Len, I love the fact you're gonna take it around the track in a few communities this weekend, and I'm sure, Pat, both in the parks as an ongoing matter with the park police, your own county and local law enforcement, as well as at the shore and our lakes, will be out there. God willing, folks will continue to do just as they've done, overwhelming compliance and doing the right thing. So hats off to each and every one of you. We'll start with John, but before we do, we're going to go down and then come back to Dave and go down. So we're going to do lanes today. There are a lot of you, so I'm asking you, John, please set the example. Please keep these brief and short. We will be here. Where's Danny? I lost Dan. We'll be here tomorrow at 1. I don't think there's a VTC. And we'll be here Saturday at 1. And Sunday will be electronic unless we think there's a reason to be with you either on the telephone or face-to-face, in which case we'll do just that. I mentioned this earlier. We hope to have, and Matt Plackett is now with us, we hope to have guidance on elections in the next day or two. We hope to have guidance, I think, on elective surgeries. We're still baking, which is more complicated, I think, than any of us thought. We are still, I mentioned earlier today, we're going to have some pool and charter fishing guidance as well. I hope all of that within the next couple of days or so. So please bear with us. If you've got questions about that, just give us another day or two and we'll get back to you on charter fishing and pools. Needless to say, we're trying to get stuff in place so we can be in as full a shape as possible when next Friday, the 22nd, comes around and we kick off Memorial Day weekend. With that, Matt, John, you're up. Good afternoon.
Thank you, Governor. On the shore reopening, can you tell us what specifics you were telling the towns and how to formulate their plans? Will we be able to see what the plans are for each town? And enforcement on social distancing, can you explain how shore towns are going to handle keeping crowds away? I mean, what do you expect, like the Wildwood Crest Beach Patrol to be going up and down? I mean, how's that going to look? There was a nurse's aide at the Menlo Park facility who died. She's the second of the frontline staff there who died. Her family and union are there saying that there was a lack of PPE early on. Can you speak to that, as well as claims by the unions and others that the state prioritized hospital PPE over veterans and nursing homes?
One more, please.
Sure. And on the unemployment website, all of the stuff that you're talking about, except for the number of claims, was in place a year ago, 20 years ago in some cases. You guys knew that there were choke points with the labor system. Your transition report said that. It's an archaic looking form, and people are going nuts who aren't getting their claims, being told you didn't fill out the form properly, we'll get around to it. How can you speak to this? And also, what are you going to do to fix this thing?
So I think on your first question, Len, you may want to weigh in here. In fact, I'd love you to weigh in. We are, as I think you're hearing today, giving guidance at sort of not a 10,000 foot level on beaches, but we're sort of setting the parameters, and we're asking, which has been the partnership all along, the local mayors and county officials to actually execute on that. And I think it's going to, part of the reason is not only do they've forgotten more about shore realities than any of the rest of us, number one, but number two, it depends on what beach you're in. Wildwood is a whole lot different than Belmar, to pick two beaches that I've been at recently myself. Len, any comments, particularly on social distancing?
Yes, Governor. Our police chief, Tom McQuillan, along with our beach patrol captain, Rennie Steele, have been working on a plan. And we do not want the lifeguards supervising and watching for social distance. We want them to keep looking straight out at the ocean and do what they're supposed to do, watching to make sure everyone is safe. We're going to have some goodwill ambassadors up there that are going to be passing out materials, just giving people notification on what you can do, and please to practice social distancing. If you must stay together and you're a large family, we're going to ask you to please put on some face shields. We're going to ask you to please respect everyone. As I said earlier, this is all brand new to us. We're going to be working together. I know our police chief is going to have a couple of police officers on quads riding up and down, making sure, just giving information out and making sure everyone is adhering to what we want them to do. But the lifeguards, we want them to do the job that they always do, and that's to watch the ocean and watch to make sure everyone's safe there. We'll watch what's going on, and that's one of the reasons why this weekend Ocean City and Strathmere and Seal has decided to do a dry run, because it's better to do it this week than we figure Memorial Day weekend, the traditional kickoff to the summer season. And we'll be able to come back and have a plan in place for next Friday. And that's the way we're going to work that. Thank you, Governor.
And my pleasure, Len. And I know each of the communities will communicate and the counties will communicate any parameters that they've got. I read of this tragic loss of life, John, as well. Remember, we started as a nation literally almost, I would say, with a pea shooter in terms of PPE, in the stockpile in terms of testing materials, testing kits and swabs, et cetera. And we have cobbled this together from nothing to 42.6 million pieces distributed of PPE and testing that'll now be able to test within the next couple of weeks 20,000 or more tests a day. That doesn't compensate for any loss of life. And so bless the nurses' aid. I don't have any insight on the particulars of the case, Judy. Do you? We don't. So we can come back to you. I don't. Again, bless the loss of life. Pat, I mentioned, I think 2 weeks ago that in particular the White House is sending in a whole other wave directly for long-term care. I will, Rob, turn to you. You hear this. Hey, you've got 19-year-old systems and all the anxiety that goes with that. Any comments you've got to John?
Real quick, thanks, Gov. I want to be careful. I don't want to conflate the certification question issue with the age of our websites or how it looks, because the certification questions are just questions that are on a standard form. And no one has problems filling out forms, or there's no form errors that are causing any delays. That being said, yes, the system is old. Some of our neighbor states have spent hundreds of millions of dollars to fix their system to no avail, quite frankly. And while when you can, by the way, just so you know, we're on these conference calls. I've been going to conferences in this job, my last job, about UI.